Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing began in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then, fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations, and then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern-day growth. You remember, the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why? We're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of U.S. adults rate lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the Love Thy Neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the healthcare they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us.